Committee of South Hams District Council for the 26th of June 2025. We are live webcasting today, so I can remind members to use their microphones and remember to turn off their speakers when they are not speaking. And that reminds me to turn off my mobile phone now. Now to the agenda items. We have the following apologies, I believe, from Councillor Lawford and Councillor Penfold.
That's correct.
So we go to item 2, the minutes of a committee meeting which was held on 27th of March 2025. Is everybody happy with those minutes as a true record?
So moved, Chairman.
Thank you. Now, I believe Councillor Bonham would like to raise a question. Councillor Bonham?
Yes, thanks very much, Chair. Yeah, just very quickly. I apologise, I couldn't attend last time, and I was very interested in the replies from South West Water. And they refer to a document called the Storm Overflow Action Plan, which seems quite central to them actually answering a lot of the questions that your committee puts them. I just wonder whether we've received that, because it was not included in the documents that Amelia circulated, and I can't find it on their website, yet it seems to be central to some of their replies. If we have got it, I'd love to get a copy, and if we haven't, maybe I could ask that we request it, please. Thank you, Chair.
Amelia has got an answer for you.
Yeah, I can go back to Alan Burrows and chase that for you and chase that for the committee.
The problem with South West Water, although that meeting was, I thought was a really good meeting, which we held them to account to a certain extent, is they are very good at not answering their questions and not coming back to this committee very efficiently, which is a great shame. But there we are. But thank you for asking that question.
Well, I want to commend the committee for persevering, because they are slippery customers, so to speak. Thank you, Chair.
Right, item 3, declarations of interest. I need to declare an interest, and I'm just covering myself in this. I'm a trustee of the Dartmouth Youth Club, and I'm also a trustee of the Dartmouth Outdoor Pool, and I've recently been made a trustee now of the Indoor Pool. So I need to declare those 3 interests. Is there any other interests councillors would like to make? No? Okay. Item 4, there are no urgent items to the best of my knowledge. Now, before I actually meant to give this, I'm actually going to give these to Amelia, because Amelia has an awful lot of support for me, and I would just like to make a very small thank you for all the hard work and effort that she does for South Hams Council, and also looking after me and Ben as chair and vice chair of this group. She does a fantastic job. And when I get the look from Amelia, I know I've done something wrong. When I get the look from Steve, I just ignore it.
Chair.
I've got my dog with me, so right. You better be careful. Right, item 5, division of the agenda. There is no reason to divide the agenda, to the best of my knowledge. There have been no questions from members of the public. So item 7, can we go to digital switchover and invite... Is the lady here?
Sadie.
Oh, so you're online. Sorry, I do apologise.
Hello, good afternoon.
Good afternoon, sir. I do apologise.
That's okay.
I was expecting you in the room, so I apologise. The floor is yours.
Thank you very much. So I'm Sodi Dillon from BT Consumer, and thank you for inviting me to give you an update on the digital switchover. I'm hoping a lot of you are aware of this. And apologies I couldn't be there in person. I'm based in London, but myself and my team, we will be visiting the Southwest region later this year in October. So that's one of the things I'll mention in my update. Now, I have got a couple of slides to present, and I believe I think I've got about 15, 20 minutes on the agenda, if that's okay.
Yeah,
So
that's
what I'll
fine.
do is
Thank you.
perfect. I'll go through my slides, and then I'll try and go through them quite quickly, give you some key information, and then allow some time for any questions anybody may have. Okay, so let me try and get technology working and see if I can share my slides first of all. Okay. If somebody could let me know when it can see the slides on screen, that would be really appreciated.
We can see your slides. Thank you.
Perfect. Are they appearing full screen, or do I need to expand them anymore?
They're not full screen.
Let me try something. Okay.
Perfect.
Let me know. Brilliant. Okay. So I will go through this fairly quickly because there's a fair bit of content, but I'll keep it very high level. So digital voice is the name of the product that we're using in BT for the new digital landline. And as I said, I'm Sody Dillon. I work in BT Consumer Food, so we're part of the business that looks after residential customers. And I'm part of a dedicated team that's been set up to support customers and stakeholders with the landline switchover. So hopefully you're all aware that this is now happening, and it's landlines that are impacted. To the home telephone service, the network is out of date. The old analog network, as we refer to it, it does need to be migrated away from. It's failing. It can't be repaired. It's very inefficient. And OpenReach, who are a part of BT Group but operate as a separate company, they pretty much own and manage the network, so the exchange buildings, the wires in the ground. And they've announced that the old telephone network will be switched off from the end of January 2027. So that's a date the service gets switched off. So what it means to us as a communication provider, like similar to Sky, Virgin Media O2, TalkTalk, Vodafone and others, that we all need to move our customers onto digital landlines ahead of that switch off. Okay, and that's why we're moving customers daily, and pretty much over half of our customers are now on a digital service. What it means for most customers, especially those customers that already have broadband, it's a simple change. Instead of your phones being connected in your home to a telephone socket on the wall, instead we move the landline service to work over the broadband connection. So you're probably familiar with a hub or router, and the customer simply needs to plug their phone into the hub or router instead, and the phone service will work pretty much the same way it does today. So no one's going to lose their landline. There's something slightly different for customers that are landline only, and I'll come on to that. Okay. But what we've done is we tried to keep the experience very simple for customers, and this is consistent across the industry, where customers keep the same number, landline number doesn't change. There's no extra cost for customers to move to this digital voice service, and over 99% of existing telephone handsets are compatible. So we're not expecting customers customers don't need to change their phones. There are a lot of benefits to going to a digital network. We've got built-in AI-based scam protection that better protects customers against spam and fraudulent calls. There's obviously better call quality. It's clearer. It's digital. It's a far more reliable network. A lot less faults. And there's extra network features like caller display, voicemail, answer phone, voicemail, three-way calling included in our service free of charge. Now, one of the big concerns from some customers, is around the additional risk due to power cuts. So I think probably many of you are aware that the landline itself today, as I say, wired connection back to the exchange, there is 50 volts sent down the line, which means that if there's a power cut in a customer's home, if a corded phone is plugged into the landline, that will generally still work because that's powered from the exchange or the cabinet in the street. Not indefinitely, but at least for a period. But with the digital voice service for those customers on the broadband service, the hub or router does need to be kept powered up. So if obviously there's a power cut in a customer's home and that hub or router isn't working, then unfortunately the customer will not be able to use the digital voice service to make or receive calls. Now Ofcom have recognised this, and they've issued a general condition to all communication providers that we need to ensure customers have a way of contacting emergency services in the event of a power failure. So we are offering our customers two types of what we call resilient solutions. So one is a hybrid phone, that picture on the left there, and that's made available to customers who are landline dependent, so dependent on their landline, and they're in an area where they've got some mobile coverage because the phone itself, the hybrid phone, has a battery built in, and if there's a power failure or a problem with the broadband service, it'll connect automatically to the mobile network to allow customers to carry on making and receiving calls for a certain period of time. If that's not a convenient solution, then we offer a battery backup unit, and there's pictures on the right there of two different types of battery backup unit we're providing, and these are simply backup batteries that are connected to the hub, and therefore if there is a power cut, they automatically keep the hub working for a couple of hours so customers can let someone know if they have a power cut or need to call someone for help. Okay. Now, we have been working with the industry, with other communication providers, to look at improving the battery backup units, and the new BBU Plus, as we call it, this has been developed in consultation with another communication provider. As well as being smaller, more compact, what we've done is we've listened to some of the feedback around customers where they do have power cuts lasting an extended duration because the batteries themselves, typical capacity will allow it to last for around about 4 hours. The Ofcom requirement is to ensure that customers have a backup for at least an hour. And what we've done with this new battery is built in a hibernation mode, a reserve feature, in that when it kicks in automatically, if a power cut is going on for a longer duration, when the battery reaches 25% capacity, it automatically switches off to save that or retain that 25% charge. And that means if a customer is in a situation where the power cut's going on for many hours or several days, they can manually switch the battery back on to use that reserve capacity to make or receive calls. Now, as well as resilient solutions and obviously moving customer digital voice, we're continuing to expand our mobile and broadband coverage. So we are part of EE, and we're continuing to build new 4G sites. Built 500 in the last 12 months, and we're going to continue to build hundreds more. We appreciate, there are still a lot of areas without mobile coverage. Openreach themselves are also continuing on with their full fibre rollout. So as a part of this digital landline switchover, we're trying to get as many customers onto a full fibre service. Some customers will already have access to what we call fibre to their cabinet, where the fibre between the exchange and the cabinet has been swapped out. But we're increasingly trying to reach as many premises as possible with a full fibre connection. So when we move customers to digital voice, if Openreach have brought the fibre outside their premises to the pavement, we'll also connect that fibre into the customer's home and completely remove the old analogue network. Now, there are a lot of customers that we know we need to take extra care with. A lot of customers rely on their landline, and there's just an example here of different categories. We know customers are particularly vulnerable where they have no mobile signal, and so they 100% rely on their landline to be able to communicate. Obviously, customers with vulnerable or additional needs. We're doing a lot of work with customers that have got medical pendants or healthcare telecare alarms, elderly customers, and of course, landline customers. So we've been putting in a lot of extra support for these customers and working with partners to make sure that we can provide the right type of support. But just switching on to landline only customers. So we have a significant number of customers that only have a landline, so they don't have broadband. So these customers, they haven't been switched to a digital landline yet. We will be doing so starting from later this year. And for these customers, we're actually going to be making a conversion at the exchange. So there'll be some new equipment installed in the exchange, which allows us to convert the customer's line to digital from the exchange. So they retain a wired analog connection to their home for now, but we were able to then move them to digital at the exchange, and therefore then they're not impacted by the switch off in January 2027. Now, these customers, there's very little change for them. We're still going to notify them when the change happens, but there's no change to the way they connect their equipment in the home. That all stays connected the same, and they actually still benefit from having line power, so they won't be impacted as much if they've suffered from a power cut. Now, in terms of how the switchover is happening, we've been migrating customers since 2018. And at the beginning of this year, we migrated over half of our customer base to a digital landline. But as we come into the final stages, we're very much focused on the customers that need that extra help, so are vulnerable or have additional needs. So we're working with the government. We've also set up a digital voice advisory group, and we work with various organisations to help us ensure we're reaching out in the best way possible to those customers that need support. So we've got key representatives from charities and organisations across the country. They've been reviewing our comms and processes and advising us on what support we need to provide for customers. The one significant sector of customers are those with what we call telecare, so the pendant devices, analog alarms. We've been doing a lot of work with government and with telecare providers, including local authorities, to identify these customers through data sharing agreements. And across the southwest of England, we've got data sharing agreements with, I think, all but 2 local authorities. So really good coverage there, but we're continuing to get everyone signed up. We're also undertaking a pilot where Openreach are sending out trained engineers to carry out a migration for a customer who's got a medical pendant. So as part of the migration, the engineers trained to test telecare equipment will install a free battery backup solution for the hub to ensure their resilience is provided, and the engineer will connect the telecare device to digital voice and test to ensure that it is working. If it isn't working, they're able to revert the customer back to their landline. So that pilot is ongoing. We've got 40 local authorities signed up nationally, and they'll probably continue on until about the end of July, early August, and then we'll go into our rollout phase. I think I can see a hand up for a question. Is it Councillor Guy? Do you want me to take the question now, or do you want me to wait until the end?
No, that's just an advance warning. I'd like to ask a question when you finish. Thanks very much.
Fine.
Yeah, we'll take the questions at the end. Thank you.
Great. Okay. Now, what we've also recently done, we've also, in conjunction with Virgin Media O2 and supported by the UK government, we've kicked off a national industry-wide campaign. That started on the 2nd of June and is across TV channels, multiple media channels, online, in GPs and in hospitals. And it's all about raising that awareness with a simple call to action, asking for any customer that has got a telecare alarm to let their communication provider know. Now, the majority of customers we have identified, but given that it's transient, people will come and go in terms of having telecare, and we may not have identified every customer, especially if they've got telecare through private companies. So simple call to action, just raising that awareness of the switchover and asking customers to contact their provider to let them know if they've got telecare so that we can provide that additional support. Now, in terms of the timescale for moving customers, so as I said, we've been moving customers since 2018. Last year, we focused very much on customers that what we call light users of the landline. But from this year, we've been migrating customers who are more active voice users. And then from spring this year, we started taking an approach to migrate vulnerable customers, but we're doing those regionally. So the previous groups of customers have been national, depending on their individual eligibility. But from spring this year, we've started to contact vulnerable customers, but we're taking a regional approach for those. So spring was in East of England, Northern Ireland, Wales, Yorkshire and Humber. In the summer, we're expanding out now to East Midlands, London North East England and Scotland. And then from autumn, we'll expand out to the remaining regions, including the South West England. And the reason for the regional approach is to make sure that we can provide this additional support. So every customer who's vulnerable, has additional needs, is offered a free engineer visit. We're also making available the resilience solutions free of charge. And we're also working with local authorities and charities and community groups in each area to raise that awareness as much as possible to help support those customers through the switchover. And just a very brief slide on this, every customer, when it's their time to switch, they're all notified by letter. So we provide at least 4 weeks notice to customers. So they'll get an initial letter from us to confirm that their line's going to be migrated to digital voice, and that explains everything that's going to happen. It also includes information to say that we'll be contacting them to book an appointment for an engineer for them, and also if there's any additional equipment they need as well. And there's a series of communication sent out to customers until the date of their switchover. The other thing we're doing is, as well as writing customers directly, we know we need to make sure that everyone's aware of the switchover, for various reasons, mainly to make sure they don't lose their landline and they know what to do when the time comes, but also to make sure they're protected and protected from scams or fraudulent individuals. So we've been raising awareness since last year, and we held over 600 events, over 45,000 face-to-face conversations across the UK last year, and we're continuing to do that this year. So we've already had events run across the Southwest through our charity partners, Neighbourhood Watch and AbilityNet. We're going to continue to do more. We are planning to revisit the Southwest region with our BT engagement track teams in October this year. So if you'd like us to host a drop-in event, so this is an event where members of staff will pitch up, we'll host an event for a day, we'll invite customers, they've got the ability to come and talk to someone. We can do that, so feel free to reach out to me. I'll make sure my contact details are shared if you'd like us to hold a drop-in event for your residents in your area. Okay. We've also kicked off a Connected Together campaign. So this is targeting the adult children and grandchildren of vulnerable customers. It's all about getting that wider engagement so that we can support those really vulnerable individuals through the switchover. So we're trying social media influencers. We're working with key charities and organisations to talk about how we can support everyone through the switchover. There's also a campaign kicked off, including member Moira Stewart. She's helped us with a case study, and she's done some pre-recorded TV and radio interviews. Again, just trying to assure customers and make sure they're aware of the change and the support that is available to them. Okay, coming on to the final few slides, we'd really appreciate is if everyone could help us raise awareness of this landline switchover. It is happening across the UK. Pretty much all communication providers will be moving customers to their digital phone networks. We've done a lot of work with identifying, working providers to identify customers with telecare. There's information available if you're able to help us amplify the National Telecare campaign. And very importantly, we want to make sure the customers are supported. So there's information on here about how any customer who's got an additional need of vulnerability can let us know. And it's a similar approach for other providers as well. Okay, there's a copy of these slides that I will be able to send out with some additional information links as well. Okay, thank you for listening to the presentation. So I'll now take any questions.
Thank you very much for that presentation. That's very much appreciated. Your consultation, well, not consultation, but your notification, I presume, is going to all parish councils and town councils, is it? I presume so. I haven't. Is that happening, or is it something I've missed?
Sorry, how do you mean? Sorry, the notification
to town and parish councils. Is that happening?
I think we could do that now that we've got this information.
Yeah. Okay.
It's already happened.
That's a really good point. I think we've been trying to engage with key organisation stakeholders. We've realised, relatively recently, that parish councils are a key avenue to help us spread that message. So if you're able to help us engage with parish councils, if there is a way we can share that, I can put some information together, a toolkit for you to share.
Perhaps if you could give that to Steve and Southampton Council, yes, I'm sure then we can pass it on to our parish councils, because it must be something that maybe I've missed. But thank you very much for that. Councillor Panel, you have the first question.
It's very kind, thank you. Before I ask my question, or two questions, I've got a quick query. Did I see that Mrs. Bowen is our goalkeeper today?
Yes, she is here.
I didn't declare an interest at the start of the meeting because I didn't know the gentleman was from BT. My daughter is a team leader with the EE broadband team in Plymouth, so I do have a connection. It's a personal connection. Is that all right if I continue to ask questions?
Absolutely.
No,
Yes,
this is a
yes,
question
it's
for,
fine.
for our
Yeah.
legal advisor, because
Mrs. Bolter will note it, but you can carry on asking questions. That'll be fine.
thank you very much. Two things. Is the battery backup pack available to all customers who are on broadband, or only those who are on receive their services from a BT company? That's the first question.
So on that question, every communication provider has been instructed by Ofcom under a general condition to ensure that they are able to provide customers with a resilient solution that allows them to contact emergency services for at least an hour in the event of a power cut. So that's a universal obligation issued by Ofcom. What we're seeing is communication providers are coming up with their own different solutions to ways to do that. In the main, the majority, what I've seen, are providing a type of battery backup unit, and the resilient solutions that BT provides, they're available for any customer to purchase, but we are providing them free of charge to vulnerable customers.
Right, that includes the elderly, I presume.
Yes, our categories for those that are eligible for free battery backup solution or free resilient solution are those with any kind of vulnerability, those that are over 75.
Oh, I'm in then.
That have telecare.
Okay, thank you. That's fine. I think I get my broadband via OpenReach. Yeah, we've recently switched in the last couple of months from the old system, from a Wi-Fi system to a superfast broadband provided by OpenReach. And now the problem is that when we get a power cut, our mobile signal nearly always goes as well. The mast loses power that serves our village. Our village of South Brent in Devon has about 3,000 residents. But I understand that while the main exchange at Ashburton will have a battery backup provided, that our subsidiary exchange in South Brent won't. So will therefore these batteries be any good if there's no power in the system, or is there a provision for that?
So my understanding, thanks for asking a question, my understanding is that OpenReach do provide a level of power resilience in all of their exchanges. So the main exchanges, larger ones may have diesel generators. But all exchanges should have some level, and the smaller ones should have battery backups, which will last for several hours, so that they work in line with battery backups that customers have. And also, as you mentioned, you moved to fibre. So if where you've been moved to fibre, I believe that effectively bypasses those smaller local exchanges, so you're then fed directly from a main hub exchange.
Is there a way I can check that with someone? Is there a contact, or could you provide us a contact?
I don't think there's anyone available. You can contact directly yourselves, but I'll take that away, and I can check with my counterpart in OpenReach to provide that information.
Thank you very much.
If you could, if someone could just capture your details, so I can make sure I can fly back to you. Or Amelia, do you want me to respond back to the group?
I can email you, and we can work it out between ourselves and sort it out.
Okay, thank you.
Because I think this will apply to a lot of our smaller communities, so that's helpful. Thank you. That's it for me. Thank you.
Thank you, Guy. Steve?
Thank you, Sodi. So as a guy who got ordinary national certificate in telecommunications in 1984, I could talk about the analog network for hours. But going back to not going to, but going back to Councillor Panel's question, if you're on full fibre, the fibre is fed from a fibre cabinet. If the cabinet is fed by the same power source that's had a power cut, then how does that help? So that's going back to the question. And I think my bigger point is that, you're here at the South Hams Overview and Scrutiny Committee, and South Hams stands for Hamlets. The Hams is for Hamlets. And there are hundreds and hundreds of places, even I've not been to. There's road signs for places that have 5 or 6 houses, and they are a place, and they are fed from somewhere. And when it comes to power, there are lots of storms that go through. Power can be off for days because it's all fed overhead. And I think I'm not convinced that the solution is broad enough. We've got poor mobile network coverage in most places. I can go to Portugal and get 5G. I can't get 5G in the South Hams. In the main towns, I'm looking to get 3G. So you've got an issue with a lack of mobile signal. We've still got places that are not fed by fibre, so they are still completely on the analog network, and there are no plans from your open reaches and so on to provide that. So I think, whilst I get the big picture of the country and what you're doing, I think there are some unique challenges that our residents, and they tend to be the elderly, vulnerable residents living in some of these smaller places, are going to face with this. So I'll leave it to you how you answer that.
No, that's a very good and fair question, and it's one that we've heard quite often raised, and you're absolutely right. We know there's a lot of customers that are impacted because they are in areas where they've got no mobile coverage and they've got poor broadband limited capacity. Just going back to your, I think, first part of the question about those with fibre going through the cabinets, the D-slams as such. So I understand that all those D-slams have battery backup. So if there is a power failure, where there's active equipment in those cabinets, they have battery backup. And that lasts for, on average, I think it's for about 4 hours. So OpenReach will have contingency plans in that when there is a power cut, they will know which cabinets are on a battery and try and keep them working for as long as possible. Going on to your wider point, so we are working in conjunction with OpenReach, and the power is a significant concern that's been raised by a lot of communities that not surprisingly are impacted by power cuts still today. So we have the same issue today with the landline, because when the power goes off, as it sounds like a lot of residents will appreciate, certain services, including landlines and mobiles, will go down. So this program, if like a switch landline to digital, it isn't directly changing that level of power resilience we have today. Okay, what we're doing is, we do need to move off the analog landline because it is failing. It is becoming increasingly faulty, and moving to a digital network means that it will be future-proofed and far more reliable. Now, as part of that change, by also moving to a full fibre network, it means that we can then provide those same customers with some additional resilience, because they're no longer then got wiring going through cabinets which is relied on power that could go faulty. And when we get customers on full fibre, they've got a full fibre connection going directly to a main IP hub. So there's less sites, if you like, that we need to focus on keeping powered in the event of a power cut. So over time, that will improve the general power resilience. The assurance that we've been given by OpenReach and I intend to work to is that no customer should be in a worse position through the switchover. And we're only going to migrate customers to a digital landline where they have the right technology. And at the moment, that technology is that they need to have some type of fibre-based broadband. So either full fibre to their home or fibre to the cabinet. If they don't have a fibre connection, by the time we need to migrate their landline, then we'll move them on to a different technology. And one of those could be the dedicated landline, which is where we still maintain that wired connection to their cabinet and exchange. Okay.
Can I ask a few questions?
Sure.
You've raised more concerns, I think, than you've actually eased. Because, like Steve has been saying, we're certainly nowhere near London, nowhere like London or an urban area. We don't have any urban areas really in the South Hams. We have our 6 main towns, but even they're very small. If there's a storm, or if there's even like I can remember we've had snowstorms down here where we haven't been able to get out of hamlets for days. That's a few years ago, I know, but we have. And I'm really concerned that those rural communities are just going to have no contact with emergency services at all. And you say that you won't take the landlines out of those areas that can't be done, but how do you assure us that those won't be done until you have found a solution for those communities? And the other question I want also is, you say that three machines will be available for those who are vulnerable and elderly, but what about those that's on benefits and those that are struggling at the present moment with cost of living crisis, etc., etc., etc.? How are they going to be looked after, and how will they access these facilities and machines? Because that's going to be really important.
Sure. On the point about that reassurance that we're not going to move customers or take their landline, BT does have a universal service obligation. So we're governed by Ofcom. We have to provide every customer with a landline service. So Ofcom are quite critical on that. They won't allow us to cease customers or move them onto a landline that's going to be any worse. So that kind of that condition, and also the fact that we don't want to drive any poor customer experience, so we won't move customers until they have got the right technology to be moved over to. In terms of customers where the funding could be an issue, you mentioned they're on benefits, low-income families. Now, this change doesn't increase any cost for them. Okay, so there's no change to the price that customers pay for their landline. There's no extra cost they incur as a result of this change. So this change itself doesn't affect the price someone pays for their telephone or broadband package. We do have products like Home Essentials, which are tailored for customers that are in receipt of benefits, and that allows them to access discounted broadband and landline products. And again, through the engagement we're doing, we can help promote that awareness if there are people out there who are struggling to pay that. And we've already got about 2 million of our customers have flagged to us that they have some kind of additional vulnerability or additional need. So we've already got a good starting point. And as part of this engagement campaign, what we're doing is raising awareness to say that if anybody does need support, if anyone's vulnerable, then there are mechanisms they can register. We can make sure that support is provided.
Okay, you haven't really reassured me, but there we are. I've been told that we have to move on at the present moment. So if Councillor Eadie and Councillor Jackson would be kind enough to give Amelia your questions, and then we'll send those questions to Sodhi and ask him for a reply. Are there any other councillors who wish to put their hand up now for a question? But we're not going to raise the questions now. Just send them to Amelia, and then Amelia will get the answers from you. Can we thank you very much for coming? We much appreciate that, and wish you all success with your transformation. Good luck.
Great. Thanks for the opportunity.
Okay.
Speak soon. Bye-bye.
Bye-bye. Sorry about that, but if you give the questions to Amelia, and then we will get those questions answered for you. Hopefully he'll answer them quicker than South West Water.
Chair, would the committee like to? So we can get the information from him and pass it out to towns and parishes. But in terms of the invitation for coming to the South Hams and doing some sort of event, are the committee supportive of that? Because we will then take that up if that's okay. Thank you.
Right. Okay. So if we go to item 8, leisure contract, can we? We've got John Parkinson, our senior leisure officer. I thought you were our only leisure officer, but it's actually. Do we have more than one?
No.
No. Okay. Lauren Parker, Devon contract manager from Fusion, and also we have Claire Bill. No, we do not have. Sorry? Apologies. Okay, thank you very much. And we've got Mark Rogers on the internet. Thank you very much for coming. That's much appreciated. Right, councillors have all seen the report in the papers in front of us. I'm now going to pass over to our senior leisure manager to introduce this item, please.
Thank you, Chair. I'll be very brief. I've got a cover report, just a couple of pages, and obviously Mark will go through, but he won't go through in detail the presentation, just give a very quick overview, and then obviously we can open up to Q&A and any issues, queries to follow up. So my report is just putting into context on a national scene, and I've cited, referenced some very useful recent reports that have come out. We've got the state of the UK leisure and swimming industry, the UK health and fitness market report, and as well the sort of annual report we get from Sport England on the active lives adult survey. So it's fair to say that the leisure sector nationally still has its challenges to face, particularly around, ageing facilities, rising energy costs, still high maintenance, and sort of still a cautious consumer spending. But on the flip side, there is still positive growth in lots of areas on health and fitness, as outlined from the recent national reports there. And then I sort of give just a little bit of local context in how we're doing locally across our centres with memberships, and particularly on swim school as well across our 4 leisure centres. And I guess one thing that's been very helpful as well is having our local task and finish working group. I know we've had site visits and follow-up questions on the working groups. That's been very helpful and informative, and I think there's an offer there. If we need to continue that, that would be very good to keep that going if that's what the committee want to do. And I think I'll leave it as that very briefly. You can obviously pick up any further queries, and I'll hand over to the screen for Mark just to give a very brief overview of the presentation, then we can take questions. Thank you.
Thank you, John. Thanks, Chair, for inviting us, and just say very much appreciate the both support and challenge we get from John and the team and members who have quite an active involvement with compared to other authorities. So it's quite constructive and positive for us. So I think in terms of agenda, I will, obviously, as John said, I won't go through every single line. We've tried to send through a comprehensive overview for you, and then we can sort of pick into any specific areas of interest. The agenda will pick out most of the key things you'd expect to see from a sort of leisure service provider. We have added some additional information in terms of the active communities functions. That's very much the activities that take place both within the 4 walls of our facilities, but also outside of the 4 walls and into the local communities, and can have the biggest impact around prevention and cure in terms of health and wellbeing issues. So we really had an increased focus in that space, and have got some positive narrative to talk through. So it's probably easiest to go to the executive summary, if that's all right, and then I can talk you through the key headlines across the contract. It's a tale of 2 parts, really. As John explained, it has been challenging within the sector. I've worked in the leisure sector for the best part of 25 years, and we have been hit by some pretty unprecedented events in the past few years. But we are on the road to recovery. Income is improving, which is positive. We forecast it would do, and that's reflective within South Hams. On the flip side, our premises costs are significantly up. Premises primarily relates to energy-related costs. There are some other things within that, but is the bulk of it is energy-related, and we're looking at initiatives to look to drive down consumption and improve sustainability in that space. As is reflective of income, we're seeing improvements to attendance, which is positive. And we're maintaining a fairly positive score in terms of our Net Promoter Score. So anyone's not familiar with Net Promoter Score, it's quite well known. I'll explain it briefly, but it gives a scale of 1 to 10 for respondents to feedback on. 1 to 6 is termed as a detractor, 7 and 8 are termed as neutral, and 9 to 10 are termed as promoters. So currently 72% of users of the facilities are scoring us 7 or more, which is good. Always room for improvement, but is a positive base to be working from. Linked to the increase in income, our fitness membership is increasing compared to the previous year, and that's due to a number of initiatives that we've undertaken in terms of training with our teams, improvements to customer service, improvements to some systems and processes, and we're also expecting that to improve further into next year. This year and next year, as we'll be launching a new website and joining platform, which we think will further improve the member experience of being able to sign up to a facility. Something that's quite interesting, and I think again is linked to what we're seeing happening within the leisure sector and probably life in general, that are concession memberships. That's the membership that we subsidise. Usually it's around a 25% discount. And that's not just membership, by the way. That includes somebody that just wants to come in and swim, or just wants to come in and do a class or another activity. We've seen a 10% increase year on year on people that are qualifying or entitled to that or asking for that. Which I think is fairly reflective of the sort of times we see ourselves in at the moment. What we're also seeing, and that again is partially linked to COVID, is a flattening of the swim school membership. So post-COVID, there's huge demand, massive backlog in terms of people wanting to complete swimming activities. The sector, as much as Fusion, the sector lost a lot of instructors at that time because swimming pools were closed. They went and found other activities. So we're gradually building back the resource to deliver those, have been working through a high demand, and we're expecting that to smooth off slightly. But we are expecting to do some operational changes which will mitigate that, and we've been trialling some of that in some of our centres recently, which has been to good effect, and we're looking to roll that out across any centres that it isn't in place in at the moment, to look to correct that position, as well as increasing some of the salaries for swim instructors in this area specifically, to aid with further recruitment. I touched a little bit around some of the work that we're doing around energy efficiencies, but LED lighting replacements have been made across all sites. That's a dual funded initiative with the Rural Communities Fund, and we're really pleased that we've got a very proactive engagement with our leadership and management courses. I remember one of our managers, senior managers there, Alex, is one of the participants within our Level 7 leadership and management course, which we support them through. And as I said at the beginning, there has really been a focus around what outreach programs can we deliver that will impact within those local areas that we're listening to the previous sector of the agenda, which we know are so important within this local area, and we want to be able to reach out to, engage with them in their areas, and then help support them to come into the facilities, which is good for them and it's good for us and the wider community. So my intention is to pause there and to see whether there's any questions around any of those things, or if anyone wanted to dig into any of those specific areas, and then we can perhaps use the slides to support that as needed, if that's okay.
Thank you very much for that. I'm going to go to Councillor Jackson. I'm sure Councillor Owen will let ladies go first.
Thank you. Yeah, 2 questions. First of all, you said your premises costs have increased, and bearing in mind that I'm from Kingsbridge, the solar panels going on, how much do you expect that to reduce the cost by? You said it was 44% increase, but if the solar panels are on.
Correct, yes. They're not currently on at the moment. We would expect a reduction, and this is me basing this on similar facilities that we've done this on, and I'm happy to come back with the specifics around that site to answer that question, but we've seen sort of circa 20% reductions in costs as a result of that, obviously notwithstanding the benefits of environmental benefits that sits alongside that. I don't know the exact number for that, but I'm happy to come back to you and provide that.
Okay. And the other one is more local, and I've been contacted by quite a few people that use the swimming pool that have been using it since its inception, which is years ago in Kingsbridge, and they're very upset that the swim-only membership is being scrapped. And I know you talked about a concession of 25, but is there any way that you could consider that going forward? To just because they don't want to use the gym, they're mainly elderly and they're on fixed incomes, and they don't want to pay for things. I think even if it's a perception thing, they don't want to pay extra for that.
I think perhaps Lauren might be able to answer that.
Thank you. We raised that in our last client meeting with John, and it's something that we are going to work on to aim to bring it back. But if you wouldn't mind just giving us a little bit more time to try and work on that, that'd be great.
Okay,
thank you.
Thanks.
Okay. Councillor Oldham.
Thank you, Chairman. Thank you, Mark. Thank you for your presentation. I had a question. I think I may have misheard you. You said that your attendance is on the rise, but the report says that year on year it's down by 102,000. So could you clarify that point for me first?
Yes, I can do. Yeah, no, you're absolutely right in terms of the reported data. I'll explain this as clearly as I can. And we have a provider that provides all of our information related to swimming lessons. That's a provider called Gladstone. They operate across our sector, and we use them to help manage the transition of swimmers across all of the different stages. It's a really important system that supports our operational delivery and communication with those groups. They moved their system to the cloud, and at that period there was then a inability for us to report effectively against the participants that were participating in swim school. So the reported data through to October 24 is showing a significant reduction in swim school specifically. However, we know that that isn't the case. We have, however, can't pull that data for that period, but that data has been corrected from that point moving forward, and therefore we're starting to see, for example, in that period, January to March, an actual increase in attendances versus the previous year. So a bit of a frustrating thing, unfortunately, was out of our control, but it is corrected moving forward.
Perfect. Thank you for clarifying that for me, Mark. The other question I see from your customer satisfaction graph, which is on page 34 of our agenda packs today, your staff has got fantastic positive feedback, but your customer service is quite the opposite. Could you differentiate what the difference is between staff and customer service, so I can get a better understanding on where your shortfall is?
I can do. Lauren, did you want to pick that question up, or did you want me to?
Okay, I'm happy to. So I believe the staff is staff on the ground that you will see face to face. Customer service is more targeted at our website journey, in which Mark suggests that we are moving across to another platform. So that's kind of the online journey, if I'm correct. The customer service and staff, is in-person experiences.
Yeah, it will be the when the data is extracted there, it will be someone has specifically stated staff, and that pulls into a staff, or good, bad, or indifferent. If we used MPS and someone has specifically stated, I've experienced poor customer service, that doesn't necessarily mean that that was due to a staff member, or they've experienced good customer service. It's relatively small in number, but we look at we receive every single piece of MPS feedback live, and we look to use that, whether we like the sound of it or not, to drive improvements in areas, and to pick up any themes that we are seeing, particularly if it's coming into one particular area. If, for example, we were saying we were getting a lot of poor staff feedback, that would be an immediate concern for us. On the flip side, if we're hearing lots of positive staff feedback, that's a fabulous thing for us to be able to go in and say, well done, you're doing great work, you get great feedback. So we do use this quite proactively, to look to recognise positive things or address things that we're not happy with. I think the biggest thing I would take away from where we are, particularly at the moment, is there's a lot of orange, okay, and that it means people are rating us around a 7 to 8. And what we want to do is to take those, keep those ones that are in the green, and move those ones that are in that 7 to 8 up into the green, and those that are rating us a 1 to 6, address those and move them up at least into a 7 or 8. So that's always our focus, trying to move, keep the greens in the green and move the other respondents up a level.
Perfect, thank you, Mark. For someone who works in sales and customer service, I was just curious in terms of what fits under what bracket there. But thank you for explaining that, and that makes a lot of sense. Thank you, Chairman.
Okay.
Thank you, Councillor Eadie.
Thank you, Chair. Thank you, Mark. My question is about the competition in the market, and I think it's quite tough out there, isn't it, when it comes to the other providers, private fitness centres and so forth. And certainly on our visit to my local centre is Iverbridge, and had a brilliant tour. I think it must have been August or September last year. Anyway, but one of the comments I have had is that the pricing structure. So my question is around benchmarking against other providers, and one of the comments I've had is that actually that the Iverbridge Centre is more expensive on membership than other providers nearby. I don't see anything in the report that comments on the nature of the competitive sort of healthcare industry. Can you elaborate on that?
Yeah, so we do obviously monitor local competition, and that is, I think it's fair to say, and I'll say the Southwest, being from the Southwest is been protected from that to a certain extent, but it's beginning to creep in more and more. If you look more widely into the Southeast and London and parts of the Midlands, there's a huge number of budget facilities that have gone into the market, a lot of franchise facilities, and in particular a trend to move towards more boutique studio, sort of small group training based provision, which is usually a fairly premium price. So compared to when I first started operating, it's probably a change from somewhere around 3,500 facilities within the UK, within England, to more like 10,000 now. So you can see that there's a massive increase, much more consumer choice, and therefore that is something that we have to be consistently mindful of. We are fortunate that, particularly within this area, we've got very well located facilities, we've got ability for people to park at the facilities, particularly if they've got access requirements. And I'd point to the concessionary membership. So whilst our view is a small charity that's really focused on trying to keep people active and support communities, we are keen for people, if they can afford it, pay to afford it. If you can't afford it, we'll support you. And therefore 27% of people that access our facilities benefit from a 25% concessionary discount. That's usually dissimilar to some of the competition that would operate, where they will tend to have a price and that's the price you pay, and there isn't usually, certainly not as deep as we would offer, a concessionary option, which looks to mitigate that. And we also look at options for people, again, if they can afford to pay and they want to pay annually, they would receive a 2-month free, or if they can't afford and they want to spread it out, they can pay memberships, or if they just want a pay-as-you-go option, they can pay and use the facility as they choose.
Just to come back on that, because I think my question is simply that: why is it that these facilities should be more expensive than private clubs that exist nearby?
So the specific answer to that would be that to operate the facility that we offer and the range of services that we offer comes at a considerably increased cost. One being the type of premises itself and the age of those facilities and the volume of plant in particular that's involved, the operation of swimming pools. So as an example, it probably, I would say probably GLL, who are a big operator, and ourselves were discussing the cost of operating a swim, and that's probably about £12.50 compared to what we offer it for about £7. Alongside the increases to premises and the difference between us staffing a facility versus a budget operator, for example, a pure gym, which wouldn't have any staff on facility and would monitor it via a camera. So we have a significantly different operating model, which incurs significantly higher cost base than the majority of those other competitors that you would mention. So I hope that answers it. It's in reflection to what we have looked to increase cost by. We obviously haven't increased our costs in line with inflation. Last year was something like 10% inflation, not quite so much this year, but still significant increases in costs, and actually bigger increases in the areas that matter to us in terms of energy. So we're trying to find that balance, and it is a balance. Don't get me wrong, but our focus is always, if someone is able to afford it, that's fine. If they need support and help, we'll look to do that. And we also subsidise exercise on referrals. That's something we subsidise further than that 25% discount. It's 250 roughly participants within the South Hams area. So these are individuals that have referred themselves to us, either along the sort of prevention route of exercise, which I touched on earlier, or around the cure route. So that might be you're going to have an operation and they need to perhaps lose some weight prior to that operation, or they've had an operation and they need to build back some strength after it. We offer a concession that we subsidise for those members for a period of time to support them on that journey. And we're really keen as well along the within our active communities function, which we either operate ourselves or we seek to secure funding from supported parties or within local areas to do even more than we can. It is the big difference between what we're talking about here with the South Hams leisure facilities, is that they are more than a leisure facility. They're a local community asset, something that people go through the generations with, learning to swim and going to birthday parties, and we want to expand them so that we're really maximising the opportunity that they offer to the local community in a very different way than a budget operator or a boutique operator might be focused on.
Okay, thank you, Mark. Councillor De Winter?
Yes, and my question sort of is related to that. I was quite surprised when I went and did the tour of the facilities to find out that for your social prescribing, that actually it is Fusion that subsidises those. I mean, I must admit I was expecting that primary care trusts or GP practices might help you out with those. And I suppose I've got sort of two questions. One, do you collect any data which because one argument was given to me was that actually if you give people those concessions as part of that social prescribing, that actually then they may go on and purchase a full price membership later. And I just wondered if you had any data that supports that or refutes it. And also whether you have had any contact at all with primary care trusts or local GP surgeries, because I just think there's a lot more scope for a kind of joint plan to encourage people into the leisure centres.
Yeah, it's a great point. And yes, we are actively involved with promoting that opportunity to general practices. That said, they are busy. We aren't the number one priority, and prescribing and exercise as an alternative to perhaps an antidepressant, which is might be right in some circumstances, might be wrong. I don't know, but we are very keen that we become a known source for GPs to refer to us. So we do constant work with our active communities team to engage with them. Primary care trusts, we again seek to be actively involved in them. It's a challenge that we find because we operate nationally, is that actually regions operate very differently. And we have got some regions that we operate in that actively fund this part of our programme, and we've got others that don't. So, you know, the more funding that we receive into this space, the more we can do. Where we don't receive it, we still look to do it. And in answer to your final point in terms of the conversion, I don't know the exact conversion off the top of my head, but of people that are referred to us, there are about 75% of those people that will then start the programme. There are some within that, for their own reason, might decide that it's not right for them or they don't want to do it. That's perfectly normal. There are others that actually we might not be quite right, so they might have referred themselves to us, and we may go, your needs are too complex, or it's not safe for us to do that. So we might have to say, you need to consider a different pathway and refer them back to their medical provider. And of those 75% that start, there's 45% that complete. I don't know the exact conversion. What we see, probably as importantly as those that are participating in the exercise itself, is that they're beginning to build that social connection. So they do a class and they may then go for a coffee afterwards, and they've got people to talk to, and it becomes part of their routine. Or they build a smaller group within the exercise referral specialists that we employ to conduct some of this activity. And again, that social interaction, that sense of purpose and achievement leads them to go on and do other things. And that might be, we've helped them to get to a point where they can get back going for walking outside. It doesn't have to be a pathway into us, but it should be a pathway onto something. But I'll ask Lauren if that's okay to see whether we can get that information. I'd be interested to see that conversion as well. And if we can, we'll share that with you.
Thank you.
Okay, thank you. Was there another question? I think John wants to come in quickly.
Only that we had a very similar question when we had this report on Tuesday over in West Devon, and it's right. Our exercise referrals and a lot of the programmes are very much all funded through Fusion. I know Claire and Karen through the outreach team, we do get odd pockets of small money from like a local health group, but it's very much not the norm. So whereas I know Rob Taylor, our regional manager, operates facilities elsewhere in Mendip and Somerset area, and in there they are drawing down health money to help further subsidise referrals, so it can open it out and get more people involved, maybe run more sessions and help with instructor costs. So that is sort of a holding back of the scheme, is able to get more funding to grow the scheme. So I think if we can, and I think Steve, we talked about what we could do as district councils, how we can make those discussions and conversations with our strategic health partnerships groups about what funding could be able to deliver, prevention and getting people active. So I think, yeah, it is a very valid point to raise.
Okay, thank you. Can the question be concise, and can Mark, you answer it concisely, because I know that Steve will be telling me in a few minutes that we need to move on. So, Councillor Creswell.
Thank you. Yes. I just wondered, I might have missed it, how often you review your pricing structure. Reason being, I booked a swim the other day, and it was £8, so I didn't proceed with the booking because it was a bit of a gasp factor from me. I'm not a member, and I was just quite shocked. I didn't go down the concessionary route, maybe what some of you might be thinking, but I didn't pursue that. So I just wondered if your pricing reflects certain centres that have been refurbished. Totnes is, as you know what Totnes is. Do some centres increase their prices because they have more all singing, all dancing things available for the clients, or is there a standard price structure? Thanks.
So I probably covered off the cost to us of swimming earlier. So we effectively quite heavily subsidise the cost of swimming through income we generate primarily through health and fitness membership. So each year we have to submit a pricing proposal, and within that pricing there are core prices, and those relate specifically to things like swimming, and they are binded by a percentage of inflation that we are allowed to increase by, unless there's an exception to that. So we go through that process with the authority each year, and we do not distinct between the new facilities, refurbished facilities, etc. We try to keep our offering as affordable as possible for those that can, and we offer, again, so if it was a £8 price for that, then we'd offer 25% off that pricing for anybody that qualified for it. And Lauren, correct me if I'm wrong, I believe free swimming for children as well up to a certain age. And also those that are participating in swimming lessons with us also receive free access to the swimming pool.
I'll just quickly come in. No, it's a good point, because I've actually raised that same matter myself through with Rob. So it might not have quite reached you yet, Mark, but I know Rob is off this week. And I had a discussion with him last week. So and I know, as you say, it's an annual increase on some of the prices, but I have raised a flag on some areas. So I will follow that up back with Rob when he's back, and then it may reach you as well at some point. But it's definitely one that we will review.
Okay, John, if something's out of line inadvertently when price increases are quite a complicated process, we'll correct it. Not a problem.
Councillor Steele.
Thank you so much. So with interest at the youth leisure nights entry for Totnes, wondered, are you able to give some comment on that? Are those going well? Are they successful? Would you consider rolling those out to other centres as well? Thank you.
Yes, so yes, they are successful, and yes, we are considering rolling those out, not just actually within this area, with other areas, because it's one of the most highly, has one of the most highest take up of that type of activity that we do across the areas that we operate. So yeah, we're very pleased with it. We want to continue to do more, but we've had for just short of 400 attendees over the last year, and it's a strong provision within that centre.
Okay, thank you for that. I'm going to make comment on the Dartmouth Youth Leisure Nights that Ben and I are a member of, and we have far more than 400 young people use Dartmouth Leisure Centre in a year than that, and I'm quite surprised that we weren't mentioned in the report, because we do use your leisure centre twice a month, and we're meeting Bryony tomorrow to actually try and see if we can use the leisure centre more in the future. Can you? I'm going to risk obviously that Steve can answer this. So we've now got we've got the solar panels going in on Kingsbridge. I believe that the other three centres are having them. I think the council has now agreed that.
Yes, the council has. Or yeah, I think they have. Or there is a report coming.
Well, I saw the press release out 2 weeks ago, Steve.
Oh, wow, well,
so I just wanted to confirm that.
So we're good to go.
I remember that when I was the executive member, but we actually got that to be approved. So councils do take an awful long time to get things done, don't they? The pool in Dartmouth, it's been so often closed this past year because we haven't had staffing, and that is such a shame. And an awful lot of my residents and Ben's residents say the same, that they would use the pool if it was open, but it's closed, and it's closed at short notice, and that's a real shame. Second one I'd like to comment on, and Ben obviously probably might want to as well, the management. Sorry, you say that the training of your staff is excellent or good. The management really does have an awful lot to do in our leisure centre. I was there a couple of weeks ago, and I was very surprised about the management and the staffing of the leisure centre that night. Really surprised. Cleanliness, that's also always an ongoing issue. and I'm going to be parochial, and I know I'm not supposed to be, but I'm going to be. We've all been parochial here. The cleanliness of a leisure centre is really beginning to look grubby. Now moving on to Totnes. Totnes obviously has wanted its refurbishment for some considerable time. Can you tell me, is that now likely to go ahead in the short term, or are we still talking to Tadpole?
Well, if I answer the question around Dartmouth first. I recognise there have been issues operationally at Dartmouth, and for that we apologise. We have been working with the local team. I've met personally in Dartmouth with the Dartmouth Indoor Pool Trust, Craig, who you know, and we have sought to try to resolve those issues, which is around programming. It's also related in part to the design of the pool, which means we're required to have 3 lifeguards on for a pool, often with 1 person swimming in it. So we operating, if there is any issue with a lifeguard, we then can't operate. It's part of the regulations in relation to the management of swimming pools that are at drop level rather than at surface level, which are challenging for us. So in terms of the cleanliness and standards, we have had a specific focus. We've had a new operations director join the team, and they've come from a hotel background, and we've retrained all of our staff around how to use cleaning products. We've looked at all of the cleaning matrix, so when they do things, how they do things, who does them, and we've seen improvements in the feedback that we're getting, but by no means are we sitting on our laurels, and we may have specific facilities that have got challenges for various reasons that need an increased focus. So I will certainly take those comments on board in relation to Dartmouth, and look at where we can do some improvements. I know Lauren will as well. Specifically around Totnes, John, I don't know whether you want to answer in the first instance on Totnes.
First on Dartmouth, I've actually got my next client meet next week in Dartmouth, meeting Craig as well, so with Rob Taylor, so we'll definitely follow. I think so, so we'll definitely follow that up, so appreciate that, Jonathan. As to Totnes, Fusion have been working on a sort of smaller minor works programme, which has been well received, but yes, very much about the bigger picture and the significant refurbishment. And I know through my director, Chris Brook, and through exec member as well, local member, Councillor John Birch, local members as well, there is a very, that discussion has moved on to really focusing on all the partners, this council, Tadpole, Fusion, possibly Town Council. Actually, we've got a costed out scheme, circa 700,000-800,000, that we're looking to see how we can all contribute and share that investment. So that I know through with Mark as well is being actively discussed. So at some point, and maybe Steve might be able to produce, there will be a report coming about that investment proposal.
So can I, because as when I was the executive member some 3 years ago, we were looking at it, and I know there's obviously financial difficulties and problems that have occurred, but what is the timescale? Because we're now 2 years on from when I left, so what is the timescale?
I do not have the exact timescale, but I know a report will hopefully come during, end of this year, after the summer, I'd imagine. Steve, I'm looking as to if it's been on any SLT agenda.
No, I mean, what we will do, Councillor Hawkins, is we will write from you as the chair of Overview and Scrutiny to the lead member to ask for an update on that. But it's to do with council funds and funding more than anything.
It's just that I do know that when I last went there some 3 years ago, that leisure centre was looking very, 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 very tired. And so, yeah, I look forward to having the reply from that. Okay, thank you. Lauren?
You mentioned a specific occasion you visited Dartmouth and you weren't entirely happy with the management. Would you mind popping me some detail, please?
Not a problem.
Thank you.
Okay, thank you. Is there any other questions? No? Okay. Can we thank Mark very much for zooming in or teamsing in? Thank you very much. Lauren, thank you very much for coming. And John, as our Senior Leisure Officer, thank you very much for coming. Much appreciated.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.
Chair, clarification for the minutes. You did say that you went to the youth events at the leisure centre.
Yes.
Just checking.
Steve, you're always welcome.
I don't know why I didn't get any flowers.
Right, okay, to finish off the item, a recommendation that the overview and scrutiny note the contents, progress of fusions. Is there anything that we want to add to that? Do we want to add that we are concerned that the facilities at Totnes have not yet been prioritised? Would people be happy with that? Councillor Oram?
Yep, I was just going to echo that, and that perhaps it would be a good idea at this point to suggest that we would like some update via the chair at the earliest convenience about a timeline or something that a skeleton of a timeline at the very least.
Yep. So can we
suggestion then that the lead member provides an update to the chair to give to the committee on plans for Totnes.
And I think we need to put the word we are concerned that Totnes Leisure Centre has not been prioritised for refurbishment. Are we allowed to say such a thing? Yes? You don't think it's necessary?
No, I don't think it's necessary. Just that we require some feedback, I think, is all that's required. I don't know about other members, but I don't think we need to go too far into that.
Councillor Creswell?
I would like to press on the timeline issue. I mean, if the report's not coming out for yet another couple of months, then we've got summer holidays and it's going to be...
Can we say that the lead member requires the executive member for leisure to give us an update on the refurbishment of Totnes Leisure Centre and a timescale? 24 hours. No, I think that prioritises Totnes. I think we need to do that.
By the next overview scrutiny committee, October.
No. No, that's October is almost what they're saying Christmas. So no, I don't think so. I would like to, right, the lead member requires an update from the executive member for leisure, I presume.
No. Leave it. The lead member is Councillor Brazil, the executive member. So an update to you as the chair.
Fine.
On the plans, which you can then circulate out to the committee.
Fine.
Ahead of the next.
Yeah. And is there anything else that we want to add to that?
Before August.
Is there anything else we want to add to that? Or are we okay? Right, okay, fine. Everybody happy with that? Yeah, okay. Hands, yes, do we need, yeah. Okay, thank you very much. Thank you. Thank you, John and Lauren. Steve's obviously got a date. Item 9.
Going looking for my flowers.
I'll bring you some next time. When is it? November, you said? We can bring in poinsettia or something, can't we? October. All right. Councillor O'Callaghan, thank you very much for coming. Izzy, thank you very much for joining us. Thank you. The floor is yours.
Thank you very much. And I'm waiting for my flowers too. Yes, thank you for that. Affordable housing is, of course, a key priority for our council. We have, of course, declared an affordable housing crisis. So that as the background, we will be giving you a summary of what we've been doing in the housing sphere in the past year, 24 to 25, and progress against our actions in the housing section of the council plan. So if you look at the introduction, I'll just rattle through that and then move on to the council plan. So as it says, we have supported the delivery of 175 new affordable homes in the South Hams for shared ownership, affordable housing and social rent. And just to explain what they are, or some examples of what they are, they include our own council-owned St Anne's Chapel. We now have 11 homes there for social rent. We originally had 8, and as you know, we added an extra 3, which had been meant for open market sale, with the help of the Second Homes council tax money, using about half of the £600,000 amount to do so. The 175 new affordable homes also include the homes operated by Live West, to whom we transferred our housing stock, sadly. Not sadly because it's Live West, but it would have been nice if we kept council homes, but that's another issue altogether. But they're operating a number in Sherford, on the edge of our district. And then we move on to open market housing schemes, which are Section 106 affordable housing negotiated schemes at Dartington, Broome Park and Sawmills, Malden, that would be Tor Hill Quarry, and Alston Gate in Marlborough near Salcombe. So those are the main schemes that we're talking about here. Next bullet point is the temporary accommodation that we've acquired. So a further 4 homes purchased for use as resettlement and temporary accommodation through the Local Authority Housing Fund, round 3. That's government money, and funding has been agreed for 2 further homes. Now, this is a huge cost to the council, temporary accommodation, as I'm sure you know, and we want to avoid people in expensive bed and breakfast type temporary accommodation, and so we acquire our own homes. And this is a huge cost to us, so we want to try to avoid that, so it's extremely important that we do this. Moving on to Bulletin 3, I mentioned the Second Homes Council tax charge earlier, so we've introduced that along with other councils around the country which have the same issues as us, and we've ring-fenced the South Hams share of funding for our housing projects as described. Unfortunately, Devon County Council chose not to use its share directly for housing. It has a much greater share. We only have the 8% of the council tax. They have a huge amount, and they chose not to do that despite the recommendations of the Devon Housing Commission. So hopefully that will change. On to the 3 further properties. I've also mentioned that just now at St Anne's Chapel. We added 3. We added 3 to the 8 we'd originally had for social rent, so now there's 11. On to the next one, back to temporary accommodation. Work refurbishing the Westfield flats at Kingsbridge has more or less been completed. I think there was final, Izzy will correct me if I'm wrong, I think it was final need to meet fire standards, so that there was a sort of last minute need to do work on that. But it's more or less complete. And then moving on to, we've upgraded all our existing council-owned temporary accommodation to achieve the highest possible EPC, which is to do with energy efficiency. And finally, on the introduction section, we did bring a report to council a little while ago, supported the, it's called the Totnes Transition Homes Community Land Trust and the Astor Housing Association with £300,000 worth of funding from the council to bring forward a 100% affordable housing scheme at Dartington at Clay Park. And I believe there'll be some sort of ceremony, Izzy may know more, we'll have some sort of ceremony marking that hopefully in the not too far distant future. And then we move on to the actual housing section of the council plan. I mean, I'm happy to rattle through it. Stop me if you want to. But starting off with, there are 4 sections. The primary aims: first aim to support communities, encourage town and parish councils and landowners to bring forward affordable housing schemes. And so we're continuing to promote the South Hams housing offer, and we have a dedicated affordable housing planner as well. And this supports communities and landowners who want to bring forward affordable housing, and the council is able to help then financially and with expert advice on how to navigate. We have half a dozen schemes currently across the district, which are at varying stages of investigation and progress. And think that's yes. So we're not too specific about them because fairly obvious reasons. We don't want private landowners perhaps looking for a greater commercial return with open market housing. So we try to keep it not too specific until we actually have managed to achieve the schemes. So we're encouraged by this, and we have certainly got at least one large scheme and a number of smaller schemes as well going on. And then the next item is working with Hastow Association on the rope walk site at Kingsbridge, which is a site that Southampton Council owns, and where we are wanting to build affordable homes, 100% affordable homes on that site. And Hastow has produced plans showing 10 new homes on that site, 100% affordable housing, as I say, on that brownfield site. So we have got a report coming to the executive on that next month. So that will be to do with a land option agreement, and so that's good news. And we will also be having an updated meeting with the Kingsbridge Town Council, who are our partners with this, who will help to shape that development. Just going back to the Southampton housing offer, I should say that if anyone knows of any land that you think might be useful, please let us know. Or if the public listening is aware of any sites that may be useful to us for affordable housing, we'd be very happy to talk with you. And then on to continuing to work with the Devon Housing Commission to identify solutions to the housing problem in Devon. We have now, there has now been the formation of the snappily named Combined Devon and Torbay County Authority. And I have the very good fortune to be a member of the Housing Advisory Group to that body. And we've just had a couple of initial meetings just sort of to set us up. And we're trying to talk about the future, under local government reorganisation with unitary authorities.
Councillor O'Callaghan, can I thank you for that? But we've all seen this report in front of us. So
okay, shall I just knock that one on the head and you can ask me
to
questions?
let councillors have time to raise questions, if that's okay with
absolutely.
you. Can I thank you very much for that?
Absolutely.
And I know from working with you over the last couple of years, I know how much hard work that you and Isabel is actually putting into this. So I thank you both very much. Councillor Breswell?
Thank you. I'm just curious, this is page 85, the primary aim, supporting the housing needs of our most vulnerable. The comment about the HUG scheme being superseded by warmer homes, and the fact there was a lack of uptake on the scheme from the contractors. Although it seems your delivery phase is starting over the next 6 months and it's on track, could you just comment on the lack of uptake from the contractors?
Well, I'll just briefly, and then I'll pass to Izzy. I'm not sure there was a particular lack of, I think this is a key risk and issue. I'm not sure there was slightly fewer. There weren't that many that we were going to do anyway. I think it was 55. And I think in the end they did 40, something like 46. So, and the reason, it sounds not very many, but they're very complex and costly, these adaptations. So that's what happened. So it was not a, it didn't go completely wrong, but they are very costly and very time consuming. I'll let Izzy explain more.
Yeah, it's flagged up in that column as a key risk and issue going forward, potentially, because we know how difficult it is to get qualified tradespeople to do these adaptations. It's really challenging. It's a seller's market out there, I think. So it's it's a sort of watching brief, giving you a bit of a flag for the future rather than something that went before, because we were quite pleased with the progress of those ones that we had been able to do, and they are very costly and very quite time. It take quite a lot of time to get those efficiencies into those properties, but it is worth flagging up for the future.
Any other questions, Councillor Steele?
I'm actually going for Izzy. A slight tangent, but Butterworth Park in Ivoriginal, you've had dealings with that before, and that project just seems to have slammed to a halt. So I wonder if you have any insight, or have you been communicating with Plymouth Homes about what might be happening?
PCH are still very much interested in bringing that site forward. They are looking at some of the technical specifications, particularly around drainage. Drainage is a challenge there. I will get an update from them, but that I last heard from them about 3 weeks ago about that, and they hadn't resolved some of the things that they were still looking at. But very much still in the chair for that.
Okay. Any other questions? No. Can I ask you a question? Thankfully, we've provided 175 new affordable homes in the South Hams. Unfortunately, with most of our social rented landlords, they are able to sell their properties. Do we know how many we've lost? And do we know, because there's an issue with what we've got in our village, do we know that they are actually spending that money from those proceeds actually in the communities where the money's being raised?
I can get the figures. We're mapping the disposals over the past. I think we've got the data now for the last 5 years as to what's been disposed of and where. So I can circulate that. Is the money being spent in the village where it's been where the property's
Or no,
been?
if it's a property in Kingsbridge that's being sold, is that money being reinvested back into an affordable home in Kingsbridge? That's
Not necessarily. Live West have committed to reinvesting in the South Hams, but not necessarily within the same town. It's probably easier for them to re-provide in a town, but some of the villages where they have sold stock, it will be really challenging for them to reinvest in there. Hence why we always say try and resist that. But as we know, Jonathan, that you've got absolutely no chance of them changing their mind.
Do we ever do an audit to ensure that that money that's raised in the South Hams goes back into the South Hams? Or do we even have a remit to do that?
We could ask them to share that information. I think that they would always be able to provide the proof of that on account of they have taken, a significant number of those 175 were re-provided in Sherford. So they have invested in the South Hams, but not within the village where they've lost the property.
And the other thing also, can I, with the change of Devon County Council, I'm hoping very much, and I voted for this at Devon County Council for the money to come to the South Hams when I was there. I'm hoping very much that the new County Council will actually do that, because that really is important. I did actually go against my group at that time, so that is really, really important.
Yes, absolutely. I'm sure they'll definitely be doing the best for the residents that they can. Yeah, but they do have a much larger share of the money than we do. But we've done all we can to use that money wisely.
And is there any other questions? No? Can we thank you very much for coming? And the recommendation in front of us is that we note the progress updated against the housing theme of the council plan. Everybody happy with that? Yeah. Okay. All those in favour? Okay. Thank you very much. Thank you. Take care. Right, Councillor Hopwood, thank you very much. I think we're nearly getting there on time now. Item 4, key performance indicators, and we have Neil Hawke with us as well. Nikki, the floor is yours.
Thank you, Chairman. Yeah, just that. So there are two reports in this within this agenda item. One is the annual performance review, and one of the figures for the last quarter. So I don't know if members have read through this and have any questions to ask, but the annual performance figures are there, and we're mostly on target. We're mostly, above target for everything. There are a few missed target things that are off target, but I think as time goes, we are doing pretty well.
Okay, Councillor Hopwood, thank you very much for that. I'm looking to the floor. Councillor Eadie looks like he wants to say something, but I'm not certain.
Well, I mean, I was just looking through it, and broadly speaking, yeah, there are not too many reds, and I think the reds that I've seen, there's, for example, missed bins is a tiny proportion of issue. Was it 99.9% have all been collected? Was it 100 in a 100,000 or something that haven't been? So the service provision there seems to be quite good. I haven't had an update about homelessness, which is, I think, when we first, very early on in doing overview and scrutiny, there was a long discussion about homelessness. What is it possible to articulate the situation with homelessness and the situation with regards to that within South Hams?
Well, there is a target for a percentage of cases where homelessness was prevented. I'm not an expert by any means in homelessness, but if Izzy is still there, I'm sure she would talk you through that one.
No, sadly, she's just lost.
Oh,
we've
Neil.
just lost her.
Sorry, you've got Neil with you.
We've got Neil.
Yeah.
Neil's saying it's definitely Isabel's.
Yeah. Well, I mean, homelessness is really difficult because, of course, not everybody wants to be helped either. But these are preventative targets. Maybe Mr. Mullin, you can talk us through.
Steve, the floor's yours.
Well, I mean, it's a difficult one, but it links back to all the actions from the previous point. So if you take Westville Flats, the council's purchased that as temporary accommodation solution for individuals, which currently get put up in travel lodges and all over, not just the South Hams, but because there aren't any, the amount of accommodation, they end up in Torquay, they end up in Plymouth, and they end up farther afield. So the investment that South Hams has made in purchasing that property, refurbishing it and turning it into quality accommodation helps us then to help local people. And it's the same with the key issue is really that there isn't enough affordable housing. And that's what the whole of Denise's, Councillor O'Callaghan's report was really trying to, the council's ambition is to try and put as much affordable housing as we possibly can to, again, reduce that demand in terms of homelessness. So it's a long-term thing, and all we can really do is make sure that we try and do the best we can to help the families and the individuals in need at the time. But it fluctuates all the time. But we're in a really good position compared to some of our neighbouring councils in terms of our performance, and the levels of homelessness are much lower than some of the comparable districts across Devon.
Thank you, Steve. Any other questions on the floor? Councillor Steele?
Yep, I guess the recycling rate, 50%. I think perhaps we asked last time, is there any plans to try to encourage residents to recycle more? I guess that if a lot of it's being burnt, there might well be fines and net zero and so on about how much waste is burnt rather than recycled. So are there plans for some sort of campaign to encourage that?
I think sorry, Chairman, I think the recycling one, we need to give it a bit longer to see these figures, because we rolled out the recycling to the rest of the district, the different recycling, and I don't think it's had time to bed in yet. I don't see it as a problem, And I do think that within the next 12 months, that figure will definitely change. We will have better recycling rates, be up to where we used to be, which used to be, from memory, something like 60%, something like that, 57%, which was many years ago. And I can't see any reason why we can't get back up to there again.
Okay,
our target is 57%, and we're on 51. So actually, I don't think that's a bad rate. It's just not as good as it used to be.
We're getting there.
Yeah, absolutely. And just the national benchmark is 42.4%. So we are above the national rate for recycling. But of course, being South Hams, we always want to do things better than they do nationally. So we are, and we will improve on that 51% to get to our target we've put in of 57%.
Okay, thank you, Councillor Hopwood. Steve, you want to come in?
Yeah, I will. Don't worry, Councillor Hopwood. Improve. So just on that, Councillor Steele, there is a detailed report coming to the next executive, which details everything from misbin performance to recycling rates and the actions that we are taking and the changes that are coming in over the next year. So that's at the next executive on the 17th of July.
Okay, thank you very much, Steve. Can I ask a follow-up question to that? Obviously, the neighbouring council had a nasty accident in the last month or so. I assume that we have done everything we possibly can to ensure that that cannot happen in the South Hams.
Absolutely. Safety is the number one concern for our 150 staff. It's one of the most dangerous industries after construction in the UK. In fact, I think it might even be higher in terms of number of fatalities, in terms of waste collection and disposal. You are talking about big machines that crush things up small with people wandering around them. Yeah. We've had a number of near misses, and we make health and safety, I review it as a director on the waste board every month. We review the number of near misses, the number of accidents that have happened, and what corrective action we need to put in place. But you'll have seen, members will have all seen that there was a Facebook post about bungee cords, and I got pillared in the my local pub about bungee cords. But the reality is there was a near miss where an operative, not in our council, the bungee cord got caught with his jacket, and the bin lift then lifted because of the cord catching on the jacket, nearly dragged the operative into the back of the bin lorry. And once you go into the bin lorry, there's no hope for you there. So it's a constant surveillance, and we have checks every day where people supervise and make sure that the crews are going out safely, they've got the correct equipment, that they've got the correct safety gear on. So key focus.
That's really good news, because I think we've all seen our recycling lorries going around the South Hams, and the speed that they load and unload the wagon is quite frightening at times. So it's really good news to hear that we're doing all we can to look after them. Right, councillors, is there any other questions of Councillor Hopwood and Mr. Hawke? No? Okay, Nikki, I think you've got away with it quite easily this month. Thank you very much for coming, and
Thank you.
See you soon, I hope. Thank you.
Thank you. Bye.
So we have a recommendation in front of us. Is everybody happy with that recommendation? Yes? Yep. Yep, okay. All right. Right, that's approved. We're now going to item 11, which is the recommendation from the Task and Finish Group concerning hunting on South Hams District Council land. Is everybody happy? Everybody's read this report. Is everybody happy with that? And are we okay to accept it? Stunned silence. Councillor Owen, would you like to approve it? Would you like to propose it?
If it makes you happy, Chairman, I'd happily propose the recommendation as per the screen.
Okay.
I'll second it.
And you'll second it? Okay. Is everybody happy with that? Okay. Thank you very much for... we have the executive forward plan on pages 123 to 130.
Can I just provide a quick update on the other two tasks?
Sorry, Amelia.
Wasn't quick enough with my slides.
Darryl would have gone a lot quicker than that.
I'm sorry, I will improve. Another bunch of flowers, I feel, are coming for the next meeting.
What for Darryl?
Right, just a quick update on the procurement strategy task and finish group. So the procurement strategy has been deferred from the July executive meeting and will now go to either September or October, and a further task and finish group to be set up to finalise the strategy. And then for the consultation and engagement task and finish group, the consultation engagement strategy has been deferred to September to allow the new lead member to have discussions with officers.
Okay, thank you for that update, Amelia.
Can I just... May I? Not about...
Of course.
It's about task and finish in general, actually. So just to let members know, I was in the peer review, came back to do the LGA peer review, came back to do a follow-up session following the 12-month review, which is standard. And one of the sessions that I was in was around governance. And the leader was there and the executive member, Councillor Birch, and one of the things that they fed back to the peer team was that ONS had been particularly successful with the task and finish groups in terms of making recommendations to the executive, and they felt that that element was working particularly well in terms of policy development, a la hunting on council land. And that was fed back to the peer team. So I just wanted to let members know that.
That's good news. Well done, everybody. Thank you very much for that, Steve. So, item 12, the executive forward plan. Everybody has obviously read that. Is everybody happy with that? That's just for noting, isn't it? ONS annual work programme is item 13. Again, I presume everybody's happy with that. And we've actually caught up with time, haven't we? We've actually almost beaten time. So the next meeting is in October of this year. Thank you very much, members. Have a great... I'm looking at Amelia just to check before I close the meeting. Have a great summer. Hope everybody has a great time. And you'll see that my dog has been better behaved than I have and not had any issues during the meeting as well. Thank you very much, everybody.
Thank you. I think you should bring